Most parents may feel overwhelming and have a lot of questions and concerns when their child is diagnosed with diabetes. Unlike an adult having diabetes, a child may find it really difficult to adapt to the new diagnosis of diabetes. This is because it is a lifelong condition. Therefore, it is important that parents are very well aware regarding how to care for a child with diabetes. This also helps your child to develop the skills of giving self-care to manage their own diabetes as they grow up. Let us understand some essential tips regarding how you can care for your child following a diagnosis of diabetes. Blood glucose levels in your child's body is carefully regulated by a hormone called insulin. Insulin is produced in an intra-abdominal organ called the pancreas. After having a meal, the excess glucose that enters the body are stored for later use, and that is regulated by insulin. Type 1 diabetes is caused by deficiency of insulin, while type 2 diabetes is caused by resistance of your child's body to the actions of insulin. When insulin is low or absent, the blood glucose levels go up. Your child may have increased urinary frequency and thirst as excess glucose are excreted in kidneys, dragging water with them. As the glucose is also not stored inside your child's body due to the lack of insulin action, the child can lose some of his weight. Diabetes in children can be mainly of two types, type 1 and type 2. As type 1 diabetes is caused by a deficiency of insulin, your child will need to be on lifelong insulin replacement therapy. However, type 2 diabetes is caused by your child's body's resistance to the actions of insulin. Most children with type 2 diabetes are likely to be obese and may also have other problems like high blood cholesterol levels and high blood pressures. However, as children with type 2 diabetes are producing insulin, they rather can be managed with modification of the diet with or without medications that help with increasing your child's body's insulin sensitivity and without needing frequent insulin injections. Type 1 diabetes is treated with insulin. Your child will need to take insulin lifelong. Type 2 diabetes, when recognized at a very early stage, may be managed with changes to the diet alone. However, most children will need medications that help with optimizing the actions of insulin. Knowing when your child is having either very low or high blood sugars is very important. Glucose can be checked easily at home using a glucometer. It is more important that you know what to do if your child is experiencing either very low or very high blood sugars. One form of prevention to make sure your child stays as healthy as possible is to have regular and consistent checkups with your child's doctor. Your child is likely to need frequent weight and blood pressure checks. And also your child will need to have some periodic blood testing, including fasting blood sugar and HbA1c. Over long term, your child will need checking of kidney functions and vision and regular foot care, as diabetes can affect kidneys, eyes and nervous system over the long run. Your child will need to match their insulin intake to their carbohydrate intake. This can be done by carefully measuring your child's insulin doses and counting carbs in your child's meals and snacks. Helping your child with eating complex carbohydrates with lots of fruits and vegetables will help your child stay healthier. Have your child eat their meals and snacks at about the same time every day. The dietitian is able to help you a lot in planning a diet that also suits your child's personal choices. Physical activity is also equally important, especially to your child's heart. Physical activity helps your child stay healthy. Physical activity helps your child stay at a healthy weight, help insulin work better to lower your child's blood glucose levels, and gives your child more energy. Even small amounts of physical activity help manage diabetes, such as when your child is physically active at school or at home. Minimizing screen time is also helpful in having an active, healthy life. Encourage your child to engage more in outdoor play activities and try to set limits on indoor play and recreational activities. It is very important to supervise your child during illness, as blood sugar levels can be highly unpredictable in the face of illness. Check blood sugars more frequently. This will help warn you early of possible problems such as low or very high blood sugars. Check often if your child is vomiting. Never miss an insulin dose. Always give some insulin even if your child is not eating as much as usual. You may need to give less insulin than usual depending on your child's blood sugar level. Give your child plenty of fluids to prevent dehydration. If you have a doubt about your child's health, bring them to the attention of your child's doctor. Proper diabetes management helps children live fully healthy lives and avoid life-threatening complications which needs emergency care. Children with diabetes, especially those with type 1 diabetes, are at a higher risk of having low blood sugar levels. This happens when they forget to take the meal after insulin injections are taken, or they take a higher dose of insulin. It is important to have a carefully planned and timed diet to avoid having low blood sugar levels. Low blood sugar levels can potentially harm your child's brain if not attended and treated promptly. Occasionally, your child can become unwell with very high blood sugar levels. The common reasons are poor compliance with diet or insulin injections and intercurrent infections. During these times, your child is at risk of developing a serious condition called diabetic ketoacidosis. It is very important to bring your child for urgent medical attention, as ketoacidosis often needs treatment in an intensive care unit. It is important that everyone who cares for your child understands how to manage your child's diabetes. This means taking the time to talk to your child's school and also any adult who will care for your child. Children with diabetes have to be more careful about their health and pay much more attention to what they are eating than most other children. They also have to check their blood sugar levels a lot and get insulin shots in time if they are diagnosed with type 1 diabetes. It's a lot of responsibility, and the needles for sure are not fun. It is therefore very important to help your child to adapt to the new diagnosis of diabetes. Your child's doctor, dietitian, psychologist, and school teacher are likely to help you very much during this process. As the child is growing old, it is also important to train your child gradually to take self-care of his own diabetes. This will improve your child's self-confidence in managing his diabetes.